Hello everyone. We are Team 11 and our project is about redesigning the birth control arm implant. Today we're presenting our novel device for funding from the NIH and private investors. Imagine this. A patient goes to their medical care provider to get their birth control arm implant removed, which is typically a quick and routine procedure, but when the doctor feels for the implant, it's not detectable at the implantation site. After an x-ray, the birth control implant is actually nowhere to be found in the patient's arm at all. After multiple x-rays were taken of various parts of the patient's body, the implant was eventually found to have migrated to the patient's lungs from their upper arm, which you can see in the image on the right. It's been found that 3 million US patients choose arm implants as their primary contraceptive method, with 0.26% of patients reporting implant migration and 0.02% of patients reporting lost implants. In literature, implant migration is generally defined as movement greater than 2 centimeters from the implantation site, and few strides have been made to adequately address this issue. Although at a glance these rates may seem small, this issue is extremely serious as migration can result in permanent nerve damage and threatening complications such as pulmonary embolisms. These pulmonary embolisms may present themselves through severe chest pains or through no symptoms at all, giving patients little warning before disaster strikes. Additionally, to remove implants which have migrated into the lungs, endovascular retrieval is used and often costs patients upwards of $14,000. And as a result, there is a need to develop forearm birth control implants which do not move from the site of implantation.
Birth control arm implants are in contact with the subcutaneous tissue of the upper medial arm as seen in the picture to the right. The subcutaneous tissue is the connective tissue that lies beneath the dermis and is considered to be the deepest layer of skin. The functions of the subcutaneous tissue include absorbing shock to underlying structures, shaping the external features, and regulating temperature through energy storage and bodily insulation. The subcutaneous tissue is primarily composed of adipose cells, which are cells that have a lipid content of typically 85% or more by weight. Within each adipose cell, fatty acids are stored in a large lipid droplet that occupies over 90% of the individual cell's volume. Primary function of adipose cells is the storing and releasing of these fatty acids from each cell's large lipid droplet, as this process enables a form of metabolic control. Adipose cells in the subcutaneous also assists the body in maintaining thermal and energy homeostasis. Nexplanon, the only birth control of the arm in the U.S., contains the hormone adrenogestrel, which is progestin. The release rate of adrenogestrel is 60 to 70 micrograms a day in weeks 5 to 6, about 35 to 45 micrograms a day at the end of the first year, and about 25 to 30 micrograms a day at the end of the third year. Progestin is most commonly used for contraceptives such as Nexplanon and are sometimes used in combination with estrogen. Some side effects from this hormone include irregular menstrual cycle, nausea, and headaches. Oral birth control pill products include Yasmin, the more generic brand, as well as Bayes. At the current moment, the only other birth control that goes under the skin in the arm in the U.S. is Nexplanon. Nexplanon is a subcutaneous arm implant made out of ethylene vinyl acetate and is 99% effective at preventing pregnancy. Nexplanon lasts for 3 years in the arm but can be removed at any time. For other alternatives, there are hormonal injection, which has a 4% failure rate and needs to be repeated every 3 months, as well as barrier methods, which have a much higher failure rate, with condoms at about 13% and diaphragms at 17%. Permanent contraceptive methods are also a method, but not a reversible process. Pills can either contain a combination of progestin and estrogen synthetic hormones or contain progestin only. Pills must be taken at a constant time every day, making oral contraceptives a daily task and only 91% effective at preventing pregnancy. Hormonal injections are a longer-term option lasting for up to 3 months and are 94% effective. Hormonal Iuds are more than 99% effective and serve as a long-acting and reversible contraceptive. The Miranda Iud is inserted vaginally into the uterine cavity and lasts for about 5 years before removal is needed. The insertion process is invasive and does not utilize pain relievers, making it an intimidating option for patients. Risks associated with Miranda Iuds are infection, perforation of the Iud into the uterine lining, and expulsion.
Our team wanted to come up with a long-term birth control option that is biocompatible, doesn't move in the body, and is reversible. We are proposing a redesigned subcutaneous birth control implant with novel surface hooks that anchor the implant to connective tissue to prevent migration. The body of the implant is composed of an ethylene vinyl acetate cylindrical rod. Within the rod is barium sulfate, used for detection in radiology, and etinogestrel, the synthetic hormone eluted from the implant. What makes our design unique is that on the surface are thermoresponsive polyurethane hooks. PU is a shape memory thermoresponsive polymer, meaning above body temperature the hooks are soft and retracted. However, in response to body temperature, the hooks extend. EVA is a common thermoplastic copolymer used in drug delivery devices. It is the chosen material for the implant because it is biocompatible, non-resorbable, and viscoelastic, with a Young's modulus ranging from 15 to 80 megapascals. These properties ensure that the implant will not cause an adverse inflammatory response nor degrade during the duration of use, but can still withstand movement and compression of the arm. Barium sulfate is being used in the implant for detection in radiology imaging in case of migration of the implant is to occur. Barium sulfate is virtually insoluble to water, so it should remain in the implant. Etinogestrel is a synthetically derived progestin, which binds to progesterone receptors. It works as a birth control by inhibiting ovulation, increasing cervical mucus viscosity to block the passage of sperm, and altering the uterine lining to prevent implantation of a fertilized egg. The shape memory polymer polyurethane is made out of hard and soft segments, which dictate the properties of the polymer. The polymer used for this birth control implant will be composed of polycaprolactone, or PCL, for the hard segments, and the PU monomers for soft segments. This mixture was chosen because it provides a glass transition temperature of 42 degrees Celsius, which is closer to body temperature, and it has a high strain recovery of approximately 70%. Additionally, PCL and PU have good biocompatibility for long-term use in the body. To manufacture PCL-PU, in a heated water bath, PU is mixed with PCL, then cast into small disc molds and baked in a vacuum oven. To process the shape memory behavior of the hooks, the PCL-PU discs are brought above the glass transition temperature, constrained into hook shapes, then cooled below TG. This process causes the shape memory of the discs above TG and hooks below TG. An implant will be manufactured using a solution lyophilization and extrusion method. Etinogestrel and barium sulfate will be mixed into an EVA solution, which is then lyophilized into a powder. This powder is put into an extruder, where it is melted at 60 degrees Celsius and extruded into a rod. In an automated process, the rod is coated in a layer of EVA, and the polyurethane discs are attached to the surface of the rods before the EVA is completely cooled so that they are welded together. This manufacturing process produces a membrane reservoir delivery system. Physiological fluids penetrate through the EVA membrane and dissolve the lyophilized etinogestrel. Then osmotic pressure drives the dissolved hormone out into the body, where it can enter the bloodstream. The EVA membrane slows the hormone elution rate to about 70 micrograms per day for the first month, which then averages to 30 micrograms per day for the remaining 5 years. Because the polymer implant cannot withstand high heat or steam sterilization, ethylene oxide sterilization will be used to sterilize the implant. The implant is inserted into the upper arm as seen in the diagram. A heated applicator flattens the hooks for easy insertion. The applicator's needle punctures the skin, and the smooth implant is delivered into the subcutaneous tissue. Then, the decrease to body temperature causes extension of the hooks into surrounding tissue. The implant is designed to provide birth control for up to 5 years. However, it can be removed at any time. Upon removal, a heating pad is used on the implant site to retract and soften the hooks so that an incision can be made and the implant easily removed with forceps.
This new thermoresponsive design of the birth control arm implant is an innovative form of a long-acting and reversible contraceptive. Alternatives, such as birth control pills, need to be taken daily, and contraceptive injections are required monthly. The thermoresponsive implant is predicted to perform for 5 years. This performance length is 2 years longer than the competitor Nexplanon, and the insertion of the implant may be more comfortable to patients than IUD insertions because it is similar to getting a vaccine injection. Additionally, the innovative design of the thermoresponsive hooks should significantly reduce implant migration by anchoring the implant to the subcutaneous tissue. One limitation of the thermoresponsive implant is that it does not mitigate any of the hormonal side effects of etinogestrel. Such side effects include irregular menstruation patterns, headaches, weight gain, and mood changes. Another limitation is the cost of the device. Nexplanon has a listed price of $1,030.64. Although the implants are very similar, containing EVA, barium sulfite, and etinogestrel, the redesigned implant requires extra manufacturing of PU hooks. The extra manufacturing makes the device more expensive than the Nexplanon at an estimated $1,200. Though, due to the Affordable Care Act, insurance companies are required to cover all FDA-approved forms of birth control. Our device has 3 main functional requirements. This device must be capable of releasing etinogestrel at a steady rate over the course of several years. The device must also prevent movement once it has been implanted in the patient and is easy to remove with minimal to no pain to the patient. We determined the functional requirements from our device objectives. The device objectives of our device are to be biocompatible and flexible to be used in the body and withstand the environment of the arm. The device must also not degrade over several years of being in the body. The last objective is the hooks must be thermoresponsive to implant and remove the device while also being easy to manufacture. The last part of the engineering criteria for our device is the design specifications. The etinogestrel must release at a rate of 300 micrograms per day over the course of 3 to 5 years. The material of the device must be able to stay in the body for those 3 to 5 years. The thermoresponsive hooks must soften at 108 degrees Fahrenheit and form hooks when at body temperature. Our device will still leave bruising at the implantation site and may cause discomfort the first few days. Because of the device biocompatibility, it should not cause any adverse tissue responses. The hooks should create more stability in the groove between the 2 muscles, but will not be sharp enough to penetrate the muscle tissue, causing tissue damage.
There are several experiments our team proposes to verify the efficacy of our device. Mechanical tests, including compression and tensile testing, will be used to ensure materials are able to endure the implant environment without causing stress shielding. Hemocompatibility will be tested to evaluate the affinity of the implant to form a thrombus. Cytotoxicity tests will ensure that any debris from device degradation or leaching is not cytotoxic. To test release rate kinetics, fluorescent labeling will be utilized to track the release of etinogestrel from drug-loaded EVA material samples placed in serum. This information will be used to construct drug release curves and determine the in vitro half-life. As control, the release rate curves and half-life values will be compared to literature values of etinogestrel released from similar materials. With regard to biocompatibility, cell contacting materials of our implant will be tested through direct contact to cells at high confluency. The control will be cells grown on media which are not exposed to implant materials. Cells in all groups will be carefully watched for adverse reactions. A small animal model will be rabbits. Rabbits are utilized in contraceptive testing as they have dual uterine horns, a short ovarian cycle, and cost less to utilize in testing than other animals. Our large animal model will be macaques, a type of primate which are commonly utilized in contraceptive testing as they have similarities in reproductive anatomy. The implant will be inserted into a similar location on the animal model as the insertion site of humans. Animals will be examined for adverse reactions at the indicated intervals. A minimum of 6 animals will be assigned to each interval, with 3 animals receiving the novel birth control implant and 3 receiving Nexplanon as a control. At each interval, the animals designated to that time point will be dissected and implantation site damage after removal between the test and control group will be compared. Animals still in trial will receive x-rays at each specified time point as well to observe implant location and ensure no migration is occurring. As this implant is in contact with skin, it will also be tested according to ASTM F719. However, it's key to note that in vitro cell and tissue culture tests are not fully representative of in vivo conditions, as local blood circulation, lymphatic drainage, and access to pathways will not accurately reflect those of a live animal. Small size and differences in physiology of rabbits limit the availability of results to translate to humans. Additionally, macaques are extremely expensive models to utilize, imposing significant cost limitations. Through reducing implant migration, our device will improve the safety of subcutaneous birth control implants. Our novel thermoresponsive shape memory hook technology prevents device migration, but still enables an easy and uncomplicated removal process, as with the application of a cold pack, they retract, leaving the smooth surface of other birth control arm implants. Additionally, although production costs are slightly higher than the competitor arm implants, the benefits of our device are life-saving and prevent expensive complications. Thank you for attending our presentation. We'll now answer any questions you might have for us.